Enuresis and incontinence pathology. The pathology of enuresis and incontinence is characterized by deficiency in the majority of cases. This may be a deficiency of the lungs, spleen, or kidneys. Lung qi communicates downwards with the bladder, and the lungs, which govern qi in general, also provide qi to the bladder to control urine. Thus, deficient lung qi is unable to control the bladder, and urine leaks out. Spleen qi raises qi in general, and a sinking spleen qi may be unable to control urine, which leaks out. The kidneys obviously control urination directly, as the balance of kidney yang and kidney yin influences urination, and also because kidney yang provides qi to the bladder to control and transform urine. Moreover, the kidneys control the two lower orifices, one of which is the urethra. Therefore, when there is sinking of qi in urinary problems, it involves also sinking of kidney qi, in addition to sinking of spleen qi. There are, however, some full types of enuresis. An example of this is in some children in whom nocturnal enuresis is due not to a deficiency, but to liver fire infusing downwards to the bladder. These tend to be tense and highly strung children. Some modern Chinese doctors, in fact, think that the pathology of enuresis in modern children is different from the old times. They say that in the old times, children's constitution was often weak due to poor diet, and that enuresis was mostly due to the child's poor constitution. In modern children, the constitution is better than in the past due to improved living conditions and diet. They therefore think that enuresis is often due to heat and phlegm in the heart from a nervous disposition. The Chinese disease entities of enuresis and incontinence must be distinguished from that of urinary syndrome or LIN. As a symptom, incontinence is often a feature of urinary syndrome, but this latter disease is always characterized by a difficulty on urination and often pain. By contrast, in incontinence as a disease, there is neither difficulty nor pain. To summarize, the pathology of enuresis and incontinence is always characterized by deficiency of the lungs, spleen, or kidneys. When there is sinking of qi in urinary problems, it involves also sinking of kidney qi in addition to sinking of spleen qi. There are full types of enuresis. Liver fire infusing downwards to the bladder is an example. The Chinese disease entities of enuresis and incontinence must be distinguished from that of urinary syndrome of Lynn. As a symptom, incontinence is often a feature of urinary syndrome, but this latter disease is always characterized by a difficulty on urination and often pain. By contrast, in incontinence as a disease, there is neither difficulty nor pain. Thank you for listening.